શું કહો સર?
પેલું ફોર્મ ભરવાનું ટ્રાય કરે
સર મહેનત કર્યો પણ ઘણા બધાએ કર્યો છે સર.
અને આવા કરવાનું એવું
હા,
possible
મને
થયું.
ફોન આવ્યા હતા 4-5 જણાને. આઈ થિંક વી આર,
Majority.
હા સર, વી આર લાઈવ નાવ. સો
Okay.
યા, શ્રેયાશી.
Yes, sir.
પેલું ફોર્મ ભરવાનું ટ્રાય કરે
સર મહેનત કર્યો પણ ઘણા બધાએ કર્યો છે સર.
I think the voice is echoing from somewhere, sir.
It was my secondary YouTube. Now you can
Okay.
start. Yeah.
Yeah, okay, sir. So, good afternoon and a warm welcome to all the dignitaries present here. I'm Srevshi from Clarinet, serving as the allocated session assistant to ensure a seamless experience. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clarinet serves as the digital partner for this event hosted by the National Neonatology Forum, Gujarat. And the focus of today's session is lessons from experts, 7 steps of easy breastfeeding. So let's begin today's session, for which I would like to invite Dr. Kunal sir to take over. Over to you, Kunal sir.
Thank you so much, Shriyashi. So today we are continuing with our neonatal Pathshala series, in which we have a very important topic about the 7 steps of easy breastfeeding. And today we have Dr. Parag Dagli sir with us, and sir was as eagerly shown interest in taking this topic, and he told me that whenever you want, I can take this topic. I'm thankful to Parag Dagli sir for showing this interest, and he is very passionate about the breastfeeding and KMC. About the Gujniocon also we had a discussion, and from his even the voice also I can make out the passion that Parag Dagli sir has about the breastfeeding, and he had shown we had a long discussion about it. So thank you so much, Parag sir, for agreeing and taking this topic for the neonatal Pathshala which we are running on every Wednesday. For an introduction of Parag Dagli, I don't think he needs any introduction, but just to complete the formality, sir is a neonatal and pediatric intensivist working at Apple Children Hospital. He is the director over that. He is a lactational counselor, a pediatric flexible bronchoscopist. Sir is a faculty at several global and national conferences. Sir is trustee and honorary secretary of KMC Foundation of India and compiled a book for UG students also. Notes of for final MBBS. Thank you so much, Parag sir, for agreeing to for this thing. Unfortunately, Nirmal sir is not able to join, but I would, as an office bearer, I would request Maulik sir to say a few words, and then we can start with the session.
I think already Kunal has narrated everything. બરાબર, મોટા ભાગના વખત શ્રોતાઓ કદાચ ગુજરાતીમાં સાંભળતા હશે, એટલે હું ગુજરાતીમાં કહું કે એસેન્શિયલ ન્યૂબોર્ન કેરનું સૌથી અગત્યનું પાયાનો સિદ્ધાંત હોય તો એ માતાને દ્વારા સ્તનપાન જ્યારે નવજાત શિશુને કરાવવામાં આવે એ છે. અને આપણે સૌ જાણીએ છીએ કે પરાગ ડગલી જેવા વક્તા હોય અને એ સરસ મજાની રસાળ શૈલીમાં ભણાવવાના હોય ત્યારે આપણા બધા માટે એક લાવો જ છે. તો વધારે સમય ન લેતા હું પરાગભાઈને વિનંતી કરું કે એ સ્તનપાન વિશે આપણને સૌને સંભળાવે.
Thank you, Maulik bhai, Kunal bhai. Can I share my screen now?
Yes, sir.
So, first of all, I must thank NNF Gujarat chapter for inviting me over here on this platform. I'm really happy to be over here and share my views and experiences regarding breastfeeding. If I'm not wrong, at the participants tarike I can see 6. Are that net number or?
Sir, some of them are, so many of them will be joining on YouTube also, sir.
YouTube.
That's why we are live, sir.
પરાગભાઈ, આ છે ને માત્ર ફેકલ્ટી લિંક છે.
Okay.
આનું લાઈવ બ્રોડકાસ્ટ યુટ્યુબ ઉપર થાય છે, જ્યાં ઘણા બધા લોકો તમને સાંભળી રહ્યા છે.
Okay, okay, okay. And I believe that this will be mainly in Gujarat only. So, જેમ તમે ગુજરાતી વચ્ચે વાપર્યું, I would have loved to do entire presentation in Gujarati. But since it is majority for doctors, so we'll have presentation in English, and wherever possible, I'll use Gujarati as well, because કેટલીક વસ્તુની મજા ખરેખર ગુજરાતીમાં જ આવશે. Okay. So, I thought તમારામાંથી ઘણા બધા, many of you must have tried to follow that quiz. Out of 10, I think, I hope most of you must have got more than 8, 9 or 10. So, whenever we are, as a third person, when we ask breastfeeding whether it is easy or difficult, most people will answer that it is easy when you are explaining somebody, but it comes to yourself, then it's actually a bit difficult as well. So, what is surprising is just what change that there are roughly 6,700 mammalian species on Earth in the evolutionary tree, and we are the supreme most. This question of easy or difficult doesn't come for remaining 6,699 species. It's only a problem for the topmost mammal, to that extent that at times we have really doubt whether we are mammalians or not, because at present data says that roughly 50 to 80% of the mothers have difficulty in either establishing or continuing exclusive breastfeeding for even first 6 months. Forget about 5 years, which we are advocating now. Despite the fact that all of us, today, whatever, there people are there on the delegate, this attendee side, they are all almost as expert as me in the field of pediatrics, and all of us can write an essay on breastfeeding, its advantages, maybe its technique and other things. And despite the efforts that are going at national and international level, for last nearly 50 years, there are hardly any improvements in the final data regarding the successful or improvement in breastfeeding status. So, although we know that this is the best God's gift to a newborn, it doesn't work in many cases, and that is mainly because of, not because of lack of knowledge, it is mainly because of the mind blocks. Now, I'll give an example. There are hundreds like this. I will just enumerate in 2 or 3. That is, after cesarean section, milk will not come for first 2 days. Breastfeeding is natural, and every mother knows it by default. They don't need any training or learning. It's something when you get a baby, you will be able to feed the child. Or if the baby cries while feeding, that means that mother has probably less milk and the baby has to give some top milk. These are some common I have enumerated, but there can be nearly 100 more which are responsible for. I'll give an example. If I say that there are no advantages of breast milk, would you agree? I think most will not. But let me tell you, is there any advantage to a lioness cub if it takes lioness milk? એક બકરીનું બચ્ચું બકરીનું દૂધ પીવે તો એમાં એને એડવાન્ટેજ શું? અથવા સિંહણનું બચ્ચું સિંહનું દૂધ પીવે એમાં એને એડવાન્ટેજ શું છે? There is no advantage. It is its birthright. It is its requirement. Primary thing. Now, if that animal takes, suppose lioness cub takes dog's milk or cat's milk, then there will be a disadvantage. So when a human baby takes anything other than human milk, then there is a chance. Suppose if I tell a mother that, જો બેન તારું ફીડિંગ ટ્રાય તો ટ્રાય કર, પણ જો તું બીજું આપીશ તો બાળકને સડન ઇન્ફન્ટ ડેથ થવાના ચાન્સ 50% વધી જશે, અથવા ન્યુમોનિયા કે ઇયર ઇન્ફેક્શનના કે ડાયરિયા થવાના ચાન્સ 50-70% વધશે. ચાલશે ને? ડુ યુ થિંક મધર્સ વિલ કન્ટિન્યુ ઓન ધેટ પાથ? એ ના થાય એટલે આપણે ખાલી એડવાન્ટેજ ભણીએ છીએ, જ્યારે ખરેખર there are nothing like advantages, and this is what I wanted to say. It was a mind block. So in this presentation, I will try to show some of the tricks or tips by which we can remove those mind blocks or obstacles with very easy things. So nature has designed actually breastfeeding to be very, very easy and supremely enjoyable. That right is only with that mother, and that mother should be able to enjoy it. So we'll try to find out what are the tricks while setting mother's position, how to hold the baby, how to attach it, and so many things. And that too in a relatively simple manner. We'll not go in any rocket science, okay? So when should, suppose a baby 1 January સવાર 9 વાગે deliver થયું, તો when should be the first feed? answers often are in the range of 1 hour to 2 hours to 48 hours. But let me show this video. This baby, or any baby for that matter, this video is of 2006. After birth, if after the mother says whatever mantra or ashirwad or kisses the baby, now is placed on mother's bare chest and abdomen. Now, the mother, whatever she does is just takes care that the baby doesn't fall away. Rest of the things baby does on its own because of certain instincts. For example, dark color of mother or the smell from nipples, glands, they will attract the baby towards breast, and baby on its own will move towards it and will try to hold or grasp the nipple, which it will fail initially, but will try again and again and again. And by the end of 10 to 44 minutes, 45 minutes, 99 of the babies will be able to directly suckle at breast. So if given a chance, if you facilitate, then the first feed will happen immediately after birth. So the step one, this process will explain in the manners of 7 steps. Sat Pagla Akashma, I think you must have heard. So we'll try to understand in the manner of 7 steps. So first step is the baby should be breastfed immediately after birth. But many of you may say that this was in normal delivery. What about the cesarean section? Remember, in cesarean, the section or incision is in the lower abdomen. There is nothing wrong in the breast side. So while the baby is being delivered and the surgery is going on, after initial cleaning or assessment, when the baby is placed inside that OT on mother's chest, bare chest, while the surgeon is doing his own job, the baby will start suckling at breast. This can be continued in the OT for next 1 hour, or while shifting the mother to the ward, or once she reaches the ward or cot, this can be continued. So, my say is, irrespective of the time of delivery, the baby should be breastfed immediately after birth, which means if 9 am deliver, 901 baby is on mother's chest and is trying to suckle. I think we all of us know that now NRP, we have already accepted that the baby should be delivered on mother's chest, and even initial steps of resuscitation should be tried over there only. Weight, vitamin K or examination can be done after 1 hour, and that first hour, which is the golden hour, is for that baby and mother and probably the family. This said that only this one step is done, believe me, 50% problem related to breastfeeding will get settled down. So if you don't remember any of the remaining 7 steps, just please remember this one step, that the baby should be fed immediately after birth. And remember, if it can be done in the first hour, it can be done in second, third, and fourth hour as well. So the first step is breast crawl. Okay, 901, we fed that baby, the baby is stable. Otherwise, what will be the next feed now? So again, at this point, many of us, you will tell that after 2 hours, 3 hours, whatever. But the baby's hunger will not be after 2 hours. It's not fixed on any clock. We all know that at birth, the baby's stomach's capacity is roughly the size of a small cherry, which by the end of 3 to 4 will rise to up to a small egg. So in this phase, the baby's stomach will fill fast and will empty fast. So the hunger will not be as per the timing or schedule. It will be very frequently. And remember, in initial tries, out of 10, hardly 2 or 3 will be successful. So remaining are anyway not successful. The baby is going to try once again after 5, 10, 15 minutes. So one should remove the clock or mobile phone from mother's area, and it should not be scheduled. Baby must be fed on demand. Now, what is this demand? Normally, when I ask, then most will say that whenever the baby cries. But those mothers who are experienced, or those who are even trained or experienced sisters, or even some of the doctors, they will be able to tell that even before crying, the baby will start certain signs or cues, which will indicate that the baby is now becoming active and it is got some hunger. For example, it will start making very, very lovable cooing sounds, or will hand movements. Then he'll try to suckle its own thumb or whatever clothes it's available. And these are called hunger cues, which are saying that now the baby is hungry. If it is fed at that point, there will be still a patience of 10 minutes, and it is possible that the baby will start suckling. So baby should be fed not in cry, before cry, and that is called true demand feeding, which is cue-based demand feeding, not cry-based demand feeding. Okay, the step 2 is demand feeding. Now, most of the times, whenever we see the baby on day 1 and then on day 2 on follow-up in the postnatal ward, or in case the baby is at distant hospital, we especially go for visit and see. Most of the times the baby is kept on other bed in the lap of some relative or in a mosquito net, well covered. When we ask why, then they say, oh, that's so that the baby sleep peacefully, doesn't get disturbed. Or sometimes even in crib. Now, what will happen if the baby is in crib? If it cries, instinctively the relative will try to swing that crib, and so that the baby goes to sleep. And only when that cries loudly, then the baby will be picked up. So then that cues are missed. So if you want to pick up the cues, the baby has to be by the side of mother. That is bedding in. And the next or optimum way of bedding in is kangaroo mother care. So the baby must be in close contact, directly skin to skin contact with the mother, something like a monkey baby. Have you seen? So that baby stays in constant touch with the mother for several months, during which whenever it wants, it feeds. The mother continues its own activities. The baby will be in constant touch with the mother, which is called skin to skin contact, which is prolonged, and it is called kangaroo mother care. So the next step is, the first was breast care, second was hunger cues, and third is kangaroo mother care. I'll just reshuffle them because after breast crawl, when there is a resting part, the baby should not go away. So it is KMC, and then third will be hunger cues, which will tell you for demand feeding. So which means that with every cue, the mother should sit down and feed. Am I right? Wrong. See, most of the promotional material about breastfeeding at national level or global level will have just one image of mother who is breastfeeding. The mother is sitting. Can you see? These are all figures. Have you ever seen such kind of figure on any promotional material? No. As if this is the normal posture of a mother who is breastfeeding. If you go to a cinema after purchasing a 1000 rupees ticket and your seat is a recliner chair for 3 hours, will you see that movie in sitting position or reclining? Why? So is mother allowed to feed in this position? No. Why? Because most of us believe that if the mother sleeps while feeding, the baby will get either aspiration pneumonia or ear infection, or mother may turn around and choke the baby if she goes to sleep. But we'll try to understand it one by one. So our concern is whether baby will get aspiration pneumonia if the mother feeds the baby in supine condition. So in this condition, the mother is sitting and baby is suckling. This is fine to us. But if you have noticed, is the baby sitting or sleeping? Have you ever seen a baby who is sitting while feeding? This is an exception, okay, for other purpose. Most of the mammals, they feed the baby in the position that the mother wants, not compulsorily in sitting, because as I already shown, baby is always sleeping only. The one who is swallowing the milk is always in a sleeping condition. The mother can be choosing her own posture of comfort in the state where she is. So initial period of 6 weeks where she needs rest, to great extent, she's learning the things, she's coping up with all the things, she must be allowed to sleep. See, this is also mammal, bat. This carries its entire life vertically upside down, and the baby suckles in that position also. Imagine this condition, if the mother can feed in this thing, if you allow her, if you facilitate her, how much relaxing it will for the mother. And I'll come to that point also, how relaxation helps. But if simple terms, if it is relaxing, when I'm saying that you go on demand feeding, trying for every time baby moves, then this will be possible only if mother is getting sufficient rest. So this sleeping while feeding is an important part. At least resting. True sleeping, I'll come again later on also. But baby must be fed with mother's comfort, and this is, believe me, first part. Because when the mother is feeding in sleeping condition and relaxed mode, and if she gets maximum relaxation when she goes to sleep, the level of prolactin will surge high and the breast milk production will increase. So the mother's sleep is actually helping the babies to get more easily milk. Does it mean that mom cannot sit at all? No, she can. She can sit with support. She can sit without support. She can walk. She can do whatever she wants while feeding as per her need or her choice. So initial period, because everyone is worried about, even the mothers nowadays are also worried about. They have not seen any mother feeding in a supine condition. We can show the first video of breast crawl where mother was sleeping, or we can show this video also. And this is called biological nurturing. Some of you might have heard this term. It said that if mother is not given any advice, she would prefer to feed in this position where she will get rest also, and the baby will suckle at his own comfort. Both are in absolute relaxation mode. So step 4 is relaxed position of mother while breastfeeding, which is called biological nurturing. I hope you remember the first three, namely breast crawl, hunger cues, and KMC. So with that, we now are prepared that okay, mother will feed in a relaxed position and with all first three steps as well. But what do we do when we try to feed? The baby keeps on crying. With everything in place, mother is relaxed and baby is brought nearby. When she tries, the baby starts crying. Then what should we do? Should we give cow's milk according to a grandmom or a formula according to a doctor? Maybe the milk is not coming. So commonly we believe that if at all baby cries while attempting to feed, there must be less milk. Okay. So now to understand that phenomena and to explain to the mother also, I only often use this thing. See, if a baby who is hungry and is given a finger, it will go on suckling it. This original video is of 10 minutes. I will just reduce it to 10 seconds for our time limited. So baby will go on suckling for 10 minutes. Even in OPD, we explain sometimes the mother, how to explain the mother, that baby will go on suckling for almost 15-20 minutes, and at the end it will actually go to sleep also as if it has satisfied. But has he got anything? No. So how did it come down? You can try it in any baby you want, but this does happen. And even you must have seen that in post-operative patients, which sometimes we keep ambient for 3 or 5 days, they are also given pacifier. Now that pacifier is in the mouth, baby is calm. The pacifier drops by the side. It will start crying. The sister will come and put that pacifier in place. The baby will start again will stop crying. So what made the baby stop crying? Milk? No. Then so all that baby was wanting was a good grip of something that would fill its entire mouth. Something like this picture or video where the baby enjoys only because that nipple, areola, everything is in its mouth, the entire oral cavity is filled with mother's breast. Not just tip of the nipple or just front part. So baby will suckle if it has a good grasp. Whether it is a finger, whether it's a pacifier, or whether it's a mother's breast. And if it suckles on nipple, it is not finger, it is not going to get anything. But if the baby suckles on milk, we all know that milk will be produced and with delivered also with the help of yes, oxytocin and prolactin. We all know that in mother's breast, with this structure, these are the glands which make milk in the effect of prolactin. And this gland, once they will make milk, These are the ducts through which the milk will be traversed to nipple with the help of oxytocin. And both these things occur simply because baby will suckle at nipple, production and secretion. So actually baby will need to suck also. It will just have to give stimulation and the milk will start flowing into its mouth. If the baby suckles properly, this thing will happen properly. But if the baby suckles in an incorrect manner, for example, if it suckles just on the tip, then actually while suckling, it will compress the ductules and the flow may be obstructed, and mother may sometimes get pain because this is very tender area, and that pain will actually negatively affect the hormones. So if the baby suckles properly, which will happen only if it has got a good grasp, the milk will surely come. It will come. Now, next question is how much? Sufficient or not? Let me give an example. The salivary glands of humans are of 25 grams net total, everything, 6 glands normally there. If you eat 2 rotis, you will get suppose 100 ml saliva, and if you eat 4, you will get 200 ml. And if you fast, you don't get anything to eat. There will be practically no saliva. So which is adequate? We have now seen that this has no storing capacity. So if the baby suppose suckles, for example, 50 ml, is there anywhere place where the milk can be stored for 50 ml? No, it is produced almost continuously, just like in salivary glands. So when the baby gives stimulation, the milk produced and instantly delivered. So almost all, except for hardly 5 to 10 ml maximum, is stored. Rest of all is actually constant production by that breast, irrespective of the size again. If the size is small, even then it can produce the same amount of milk. So milk production actually depends on a good latch and mother's rest. With that, the hormones will come into action. They will produce the milk and they will supply also both the things. With this, the baby's weight will gain. This will actually increase satisfaction. This will actually improve the hormones and the milk may drip also while the baby is suckling. So in simple terms, if there are 2 babies to a tigress, she will produce milk for 2. If there are 3, for 3. And if there are 4, they will produce for 4. Out of this, suppose one baby dies, the next day she will produce only for 3. Out of this, if one baby is lost somewhere nearby and is not available, she will produce milk for 2. There won't be milk dripping for the 3rd or 4th while 2 are taking milk. So milk production will actually this is true demand production. And if that baby returns, she will again produce for 3. So if a mother has a 2 kg baby, she will produce milk for 2 kg. If the same mother has got a next baby of 3 kg, she will produce for 3 kg. And if the same mother has got 2 babies whose collective weight is 4 kg, she will produce milk for 4 babies right from day 1. This video is taken from above, where the mother is actually lying absolute flat and both the babies are suckling simultaneously. This is just to show that milk production capacity of any human breast is unmeasurable, no upper limit, and it will produce milk as much as required, provided there is a good grip while breastfeeding and the baby goes on suckling. So step 5 is good grip will produce sufficient milk, that confidence. 4, 3, 2, 1. I'll just repeat: biological nurturing, kangaroo mother care, hunger cues, and breastfeed. So after this 5, I believe the most tough part comes is because everything depends on how the baby starts suckling at breast so that it will provide that sufficient stimulus. So for proper milk production, please remember, or even proper suckling, please remember, the first part important is mom's her own comfortable position. If the mother is in comfortable position, then only she'll be able to try more and more time or practice more and more so that the baby learn how to suckle properly. And second part is learn suckle properly. For that, actually, while I was doing my MD before 25 years and I was a ranker. I was number 1 in my our batch. But then even then it was very difficult for me to remember those 16 steps, 4 steps of mother position and 4 steps of baby and latch and attachment and not. So I tried to find out and I actually found out that there are simple 4 steps which will help you to help establish baby how to attach properly. And that is called BTN. We'll show in the video also that B is baby to breast, T is tummy to tummy, and N is nose to nipple. We'll see in this video as well that in condition, remember the baby is brought to the breast is never pulled. Okay. So now see this. Baby is brought to the breast is not pulled. The tummy was touching the mother and nipple was offered. I think I'll show it again also. Okay. See, the nipple is directed towards the nose and the baby will open its mouth fully and then only it is brought close. This is when the mother is sitting while feeding. If it is sleeping, you already seen it in the first video. Okay, so in either condition, mother can be helped. We'll show it in one more video, don't worry. It is same, again, B to B, tummy to tummy, and nose to nipple. And you see, if the baby is offered breast directly into the mouth, it is sometimes difficult to attach. Can you see? She tries, but baby doesn't want a good grip, so it's not happy. But now, when the mother offers the nipple over the lips, between the nose and lips, then baby will open the mouth and will have good grip. So idea is that nipple should go, you can move your tongue in your own palate and you can try to touch the soft palate by moving back and back. There the tip of the nipple will go and then only baby will suckle properly. So then this video which I have already shown earlier, if the baby's cheeks are touching, how does mother know that nipple has reached the palate? If the cheeks are touching the breast, if the nose is almost closed, don't worry about the nose block, it will never happen, okay? I would show it, if you block your nose with the help of your palm, you will never be able to block the nose. The nose doesn't get blocked. Anatomically, it is designed like that. So without worrying about nose block, the baby should be brought closer and closer so that when the baby is feeding, the gap between cheek and chin is gone. So it is called C2C, BTN and C2C. Or even the chin is inside the cheek. So it is again C2C. And when baby is feeding, the mother will feel that the feeding is absolutely enjoyable, no pain at all. So if there is any incomplete latch, the mother will feel pain. And the answer to that pain should be mother should try to adjust the baby somewhat rather than accepting it. So please remember this, that if the mother has any kind of pain, the attachment is not proper and it needs some adjustment. So for that, actually, you will have to see what is happening, and that is called breastfeeding examination. So the sixth step is breast crawl. I hope you have remembered by now the first 5 steps as well. I'll ask again to somebody if somebody can give in reply. But the sixth step is breast crawl. So as in breast crawl, sixth step is BTNC. Sorry, it is written wrongly. Okay, we tried all these 6 steps. Some people will say, even then, the things which we finally want doesn't happen. The baby doesn't learn on first or second or third time. Remember, if we had tried right from first time, maybe 50% would have settled down. But then 50% might or not have. Then what to do? The baby doesn't suckle at breast. Should we give cow's milk? Remember, at this point also, human milk is much better than animal milk. We all know. So it is the baby who cannot suckle at breast. The breast are ready to give. In that case, hand expression and express it and then give it to the baby. That can also calm down the baby, and that can can calm down the mother or relative as well. Maybe doctors as well. So if the baby cannot suckle, even then the option is to express the breast milk, which can be done very easily with hands. Of course, people are currently or nowadays very fond of using techniques and instruments. This is also a very simple method without much investment or tedious procedures of cleaning. This can be just wash your hands and have the clean container. But the idea is to know correct technique, which means that while expressing, the mother will first have a wide grip. With grip, she will actually give pressure towards the chest wall. and then towards each other, maintaining this pressure. I'll show it in the video as well. So while expressing, okay, this is a massage which is not absolutely indicated, but you may do it so that you will start producing milk. Even this is also a massage. This is also a massage only. Even mother can just move her fingers on the tip. That's also massage. Now this you have to remember. While expressing, mother has to press towards the chest wall and towards each other finger. With that, initially there is no milk. Don't worry. Well, that is not diagnostic that there is no production of milk. Even after 3 or 4 times, there is just one drop coming out with difficulty. That is also normal. But with continuation of the same procedure for another few minutes, the milk will start producing and dripping out. Essentially, we try to mimic what babies does at breast. With that technique, as I said, in case of direct breastfeeding, mother will not have any pain. So if you are having any pain while expression or even feeding, the technique needs to be changed. Okay. And this milk, once removed, can be given to a baby with the help of spoon, paladai, and several other things. But what we have tried is with this thing, which is a small 30 ml metal glass or cup. And this works so nice. It is very easy to clean. And mothers, on even the say minimally trained staff also learn this thing very fast in just day or two. For first 1 or 2 days, there may be some dripping at the side, but then both will learn and baby learns to take. With the help of finger spoon, there's a difficulty you while you go for feel this spoon, the baby starts moving around. Similarly, with paladai, there is a sharp edge which I'm scared of. Even the big can sometimes cause trauma because babies are very active sometimes. Well, this one will not cause any harm and it is very easy to clean as well. So till the baby starts learn to breastfeed directly, the seventh step is baby should be given express breast milk. And with that, with these 7 steps, breast crawl, demand feeding based on hunger cues, kangaroo mother care, comfortable, relaxed position of mother, confidence that there will always, with all mothers can produce sufficient milk. Forget about the exceptions of 0.001%. All mothers are capable of, and trust me, I have seen it. Okay, all mothers are capable of producing sufficient milk for their n number of babies. BTN and C, and lastly, expression and cup feeding that should help almost all mothers who successfully breastfeed their own babies. So my humble plea to all of you who are listening this presentation is please take an oath that number one, your own child, whichever is coming next in your own family, maybe your own, your sisters or brothers, whomsoever, will receive its own mom's milk. You will try to help them as much as possible. You will make that thing happen. And I'm sure if you will help that one mom and if you will be successful, which you might be successful after maybe 5 or 10 attempts, don't worry, you carry on. I'm sure you will be so happy that you will go on helping all other mothers that come in your contact. We have prepared one small, say, brochure or flyer that you can distribute to mother. This is in my name, but I can send it to a blank name. You in the last part you can write your own name, but this will be definitely helpful to all mothers. All the steps except the first one, which you will have to see it on your mobile as a video. Rest of all steps you can show with just figure as well. I hope I have tried to explain this breastfeeding in as simple way as possible, but I'm sure you people will have lots of questions or doubts about this. And believe me, these doubts will not go by simple my telling. You'll have to experience it. You have to ask it to people. At present, I'm available. If you want to ask me, feel free. I'll stop sharing at this point.
If anyone has any doubts, they can post it in the chat box. Since we are live on YouTube as well as on the Zoom.
So if the organizers uh, can ask the questions on their behalf, if at all somebody has asked these questions, we shall go for it. Or in the interest of uh, people, or we will just discuss that quiz part if at all you are interested. Let's first see if anybody is interested to ask any questions, and anyone including કુણાલભાઈ તમને બી કઈ પ્રશ્ન જેવું લાગતું હોય આ બધું જે મેં કીધું એમાંથી કંઈક ડાઉટફુલ લાગતું હોય તો feel free to ask. I'll be really happy to share whatever things.
Sir, it was excellently covered. Sir, some units are using pumps. They are preferring pumps over express breast milk. So,
Yeah.
is actually it increase whether it increases the quantity of the milk, or is there any effect on that, or it is the same with manual expression against the pump expression?
Okay. So one thing I think I have made it very clear that it is the technique and mother's expression which is important. So if mother is adequately relaxed and there is no pain, with that, if the technique is proper, which mimics baby either with help of hands or machine, both will be effective. Since hands are easily available and they are equally effective and they are easily manageable, like you can clean them very fast, very easily. That's why we prefer hand expression, and it has been found out to be more effective because it is more human, I think. So this is more effective, but it's okay to use pumps as well. And only thing is that the pumps which are effective, they are usually pretty costlier. They are costlier in terms of lakhs. So they start at 1 lakh. If you are trying to use the one which are available at 4 to 20,000, and if we expect that they will work as good as hands, then I'm sorry to say that's wrong. So hands are much better than these easily available things. The one which are actually made for hospitals, hospital grade pumps, which are costing up to 2.5 lakhs rupees, they are effective. But then they have, again, they need a cleaning, they need maintenance, they need that's a cost also. That's important.
So there is one question where when the mother is while cesarean section is there and the mother is not conscious, for
Yes.
them still expression of breast milk can be done and baby could be fed, or if temporarily we can give any other thing.
Okay. So I would request first obstetricians that except for those mothers who need to undergo general anesthesia,
Yeah.
please don't use sedation. It is not required. You may use analgesics which are non-sedative, but one should refrain from using sedatives because they have got multiple disadvantages and no actual advantage. Now, having said that, if the mother is unconscious, then I think it is a bit difficult to express breast milk in that condition. So, in those scenarios, one will have to use temporarily whatever things available, which might be any milk available to their baby. We just have to remember that any option, formula milk, will be one in comparison to the 100, which is breast milk. So it will be used for that temporary thing, which would be not more than 3 to 4 hours. And I believe it should be in exceptions in the range of 1 to 2 per CS mothers out of 100. So rest of all mothers can be offered right at birth.
Also, I think that is it for the questions. We can discuss the quiz, sir, which you had sent.
Okay. One or two important, I mean, very, I say, interesting things I would like to share it before I go for quiz. We nowadays offer breastfeeding, we advocate for breastfeeding up to 5 years. Even WHO has now recommended breastfeeding for 2 to 5 years as long as the baby and mother are comfortable. Now, why that 5 years is selected? So there are 2 or 3 reasons which we need to know. Because if you understand that initial hard work of establishing breastfeeding is going to act for next 5 to 25 years, then only we'll try more and more during initial part. That's why I'm just explaining that during 2 to 5 years of period, although most mothers are currently have left breastfeeding in this era, and maybe even doctors would also say for the same, but it's probably not correct because the baby's immunity is not mature till 5 years physiologically. Until that time, the breast milk will act by two methods. One is it will provide, it's a vaccination. So it will provide immune factors to prevent infections. And if the baby gets infection, by that if a baby has got viral infection, while suckling, some amount of saliva actually goes back into mother's breast because of the pressure changes inside the oral cavity. This is called backwash breast milk, and that will carry those antigens from baby's mouth to mother's lymphatic tissue inside the breast. That will stimulate production of immune factors against those particular virus. And now breast milk will provide immune factors against those particular virus. Now it will work as a medicine, something that a pediatrician does. It will give vaccination and it will provide medicines, taking some cost also. And nature has designed this thing in the baby for the interest of baby. So that is one thing. Second thing is the capacity of human brain to grow in terms of number of brain cells or neurons is complete by 5 years. Majority in 2 years, but then remaining part is 5 years. So if you want to attain that number of brain cells, right, it's absolute volume. The only chemical that can increase that breast now growth factors is present in breast milk. So by providing breast milk up to 5 years, you can have an IQ of 10 to 12% more than remaining population. And third thing is the bonding. It's been studied that these babies are less antisocial in later life, more bonded to mothers. And contrary to belief that this will be always be clinging to the mother, they are rather more confident in their later life. So for all interest, one should try that the baby should receive breast milk as long as possible. I will recommend a site called Breastfeeding Support for Indian Mothers, BSIM. That's a wonderful site. There are 1.5 lakhs mothers on an average in that group, which will post to the queries raised by other mothers. And there are several mothers who post that they have completed the journey of 3 years, 4 years, 5 years. The admin of that group has given breastfeeding to its two babies for a total of 13 and a half years. 7.5 years to one and 6 years to another baby. 2.5 years was the period during which both the babies were suckling at her breast. And believe me, this is a very modern kind of mom. You can see a photograph in that website also. And now I'll just move on to the queries of these questions which were asked. The baby should be breastfed every too early. I think that part we are already clear. That doesn't mean that mother has less milk. So answer is obviously no. Some pain at nipples while breastfeeding is normal. The answer is again no. The mother should not learn to tolerate it. Mother should try to adjust it. Okay, and she should try to get rid of the pain. Rather, she should get the enjoyment. A healthy twin of 2.2 and 2.5 kg at birth must be given extra milk after say 2 to 3 months, as the mother's milk will not be sufficient. I hope I have again clarified this thing that mother's milk has get no upper limit of capacity and she can definitely provide breast milk. In fact, I had some 6 to 8 twins baby who have received breast milk for up to 6 to 8 months. A mother needs amoxicillin for throat infection. She should not feed her baby as the drug can cause diarrhea due to amoxicillin. Is again a no answer. The level is actually very low and the risk is actually very low as compared to stopping and giving something else. If the mother gets viral URI, I think I've already answered this, that her breast milk during her illness will contain immune factors, which was called backwash breastfeeding, and the baby will get advantage. A baby start crying soon after feeding or crying whenever mother brings baby to breast means the milk will be less. I think that is also now clear that it is wrong. Baby doesn't need any extra milk. Rather, she needs to be taught how to directly breastfeed, or if required, express the breast milk and give. The mother should not breastfeed her baby in lying down position as the baby can aspirate milk. I think I have made it very clear, and right from first slide to even the fourth and fifth, the mother should be encouraged at least initially to give feeding in her most relaxed condition so that the feeding will be easily established. If the baby is taking a good balanced diet, the baby is at no loss if weaned off after 12 to 18 months as per mother fish. I think I have also made this point clear that up to 5 years, baby has its own advantages Rather, it is probably a requirement, although I call it now advantage, it is probably a requirement. After cesarean, mother will not have sufficient milk in first 2 days. I must say that I was believing this thing when my baby was born, and I also have photographs of giving my baby syringe feeding a formula. But I must admit I was wrong, and baby, all the mothers, and that was true in case of my brother's child, which was after say I think 5 or 6 years, and that baby after cesarean delivery did not receive any milk. He was 3.9 kg, and the gynecologists were actually very, very worried, but baby did not receive any formula. And currently available formula are as good as breast milk, and one should prescribe them whenever there is any problem with breastfeeding, like less milk, cracked nipple, or baby refusing to suckle at breast. Uh, Recently they have started marketing of formula with HMFs. That now we have two HMFs in our formula, and the cost of formula earlier, which was 400, is now written at 1,000. Human milk has got around 135 HMFs, and to my surprise, and I think to your own surprise, human milk has got second largest solid component. 85% is water. The first largest is lactose, and second largest is not protein or fat, it is HMS. So second largest component is HMS, which is not digested by baby, which is a nutrient for the baby, but it is nutrient for the flora that is going to develop. So it's a probiotic, prebiotic for the probiotics, and that is why it has got 135 HMFs. Now, should I say that formula is equivalent? I think I'm fairly clear. Anything else, Kunal bhai? Can we
Yes, sir.
have?
Sir, I think it was very, very, very clear to everyone that everybody should take a oath also that they will promote breastfeeding, and at least even I would say thousands and millions of babies should probably get promoted, but at least even if one is also increased, I would say that
Yeah,
you
that
had done a
one which is
great,
in your
great
own
cause.
family, if it gets benefit, the purpose of today's presentation is done. I'm really
Yes.
happy with it.
Yes, sir. So it is, sir, truly thankful to you, sir, for such a wonderful presentation. It was very simple to understand, and you had put all the videos and all those. So it was really a live presentation, and I think all of them will be benefited. And this will be in our Gujarat NNF YouTube channel also. So if those who have missed can also attend and see. It will be there for lifetime. Thank you so much, Parag sir, for the wonderful presentation. Yes,
I
sir.
would just add, I would just add one more thing. If anybody feels this is useful for them to present it anywhere, please let me know. I'll give this entire presentation to the person who's interested, and I'll be really happy to share it if at all it is helpful to any other person at any time.
Sure, sir. Yeah, thank you so much. Thank you all the delegates, and thank you ClearNet for the seamless experience.
Thank you,
Shreya,
sir.
yeah,
Thank you.
Shreyansh.
Good
Thank you,
evening,
sir. Thank you so much, everyone.
Gujarat
So
people.
with yes, sir.
I'm sorry.
Yes, sir. Parag, sir, you can continue.
So I would really be thankful to the organizers of this neural Patsala. I'm really happy the way you are conducting these sessions for upliftment of knowledge of so many people. And I would be really happy if at all I'd be helpful in any further way in any future. There are several other topics like even kangaroo mother care is also something which is up till now not taken very seriously. But let me tell you, I mean, not breastfeeding and KMC collectively can reduce the neonatal mortality by nearly 50 to 75%, and this was studied in 2005. So, although we all are actually very much fascinated with critical care, and that's also important, I'm not denying it. But then one large area is missed by probably all of us to that extent that currently I get so many pediatricians themselves as patients or obstetricians themselves as mothers who are facing difficulties while breastfeeding. We try to help them. They are really happy. I forgot, but I should have shared a video of an obstetric mother where she was so happy with breastfeeding, and that can happen to anyone. So I would be really happy if everyone is enjoying breastfeeding.
Thank you so much, sir.
Thank you.
Yeah, Shreyashi, over to you.
Yes, sir. Thank you, sir. Thank you so much, everyone. So, with everyone's permission, I'm ending the session over here for today. Thank you.
Sure.
Thank
Thank you.
you.
Have a nice day.